All right, how's everybody doing today? I'm here with my man Cory Ginther. Gonna have a little bit of conversation, go back and forth about a little bit of things. So let's get started. All right, Cory. So tell me a little bit about yourself, what you do, stuff like that.
Awesome. Yeah. First of all, thanks for having me. I'm
Absolutely.
excited. So I'm a performance physical therapist, and I like to say a movement specialist. You know, going to school and really just learning about the human body, and combining that with my personal and professional background with athletics and working with athletes and all that sort of thing. I love doing that and helping people feel and move better.
Absolutely, that's amazing, man. All right, so first question I want to ask you is an important one. I feel like, how do you bridge the gap between like a performance physical therapist and like a trainer, and like the different, like kind of notate some of the differences or subtle nuances and stuff like that? How do you do that?
Yeah, that's a tricky one. A traditional physical therapist, someone who only works with people, treats individuals after surgeries, accidents, strictly after injuries.
Right.
You get them from point A to point B, and typically insurance cuts them off, and that's that. But they are nowhere near ready to perform at a high competitive level again.
Mm-hmm.
Right. So I like to consider a performance physical therapist as someone who can bridge that gap, like you said, kind of like a hybrid role between a traditional physical therapist doing all the table stuff, hands-on treatment, to actually getting someone to move better and perform better, whether it's baseball, tennis, soccer mom, whatever it is. So typically it's those higher stages, advanced stages of rehab, getting someone ready to perform at that higher level.
Absolutely, that's amazing. I feel like you, because I work with you, so I kind of know your style and stuff like that. So I feel like you have a very good skill, and like really everybody that you work with, very specific. All right, so we're gonna do this, this, and this, and that, and that's gonna kind of translate and stuff like that. And I'm like, man, I just never seen that with like therapists, other therapists that I work. So I can really appreciate that. You know what I'm saying? So definitely. So let me ask you this. So what modalities or like exercise techniques and stuff that you like to implement or use the most? Like just overall, what do you think?
Sure. Well, when you go through school and learning everything, building up your foundation, your academics, you learn all the typical modalities: ultrasound, STEM, IC, all those things you see in a typical setting in clinic, right? I was very, very fortunate to have some really amazing mentors in my schooling, and as far as like my clinical rotations, and my first year out of school. People that taught me the importance of independent exercise. Really leaning away from all those modalities, STEM, ultrasound, all those things I listed, and getting people to move smartly and correctly, the right way, and move better, and teaching them the skill set via exercise to take care of themselves. So like I said, everything I do, I've learned from mentorship, and everything I prescribe as far as an exercise is done and completed with a purpose. Do X, Y, and Z in this order to get someone, from table exercises all the way to standing and eventually squat or deadlift or push press.
No, and I love that because like I said, working with other therapists in my time, I kind of see the differences, and sometimes they'll do like, all right, so we're gonna have you just try this and we'll see how it goes, and or they, all right, we're gonna have you stand and try this and we'll see how it goes. It's like trial and error versus you have a set plan and say, all right, this is what you're going through, this is what you're facing, so let me put you through like you said, X, Y, and Z, and kind of take it from step by step. And I feel like that's a great approach, so I can really appreciate that. Definitely.
Yeah, I've learned you can't just approach every single person, athlete, situation with just a shotgun approach. Because then, we're no better than any guru trainer that we see online. Like everything is done with a purpose. So with goals in mind.
Yeah, that's awesome. So what do you think your biggest challenges as a therapist and even a trainer have been, or like even if you can separate with therapists, what has been your biggest challenge, or a performance trainer, what has been your biggest challenge?
Sure. One of the biggest pieces of advice that I learned the hard way, I would say, in one of my rotations was I need to match the effort given by the patient. Meaning I cannot go 110% with every single person that I'm given in a traditional clinic. to somewhat match the effort and the interest given by that person.
And like the respect of like if they're not as advanced as you would like them to be, or they're kind of like sedentary lifestyle and they come into you, then you have to kind of dumb it down. Is that how you approach it, or?
Well, I always need to do my due diligence and my very best to educate people as
Right.
far as the importance of exercise, healthy lifestyle, wellness, all that sort of thing. But I guess that's one of the differences too between working in a traditional clinic compared to a performance training type environment where, you know, athletes are coming to you to improve their game or competition, whatever it is. Where oftentimes in a traditional clinic, you know, people are referred from their, you know, primary care providers and
Right.
just to try physical therapy for 4 to 6 weeks, and they're not really sold
Like,
on it.
yeah,
They don't really want to
exactly.
do
Like,
it.
If it doesn't work, then we'll go back to the drawing
Yeah.
board and stuff like that. So yeah, no,
A
I
lot of
get it.
people, they don't want to exercise and they don't want to do what they need to do to get that work in.
Yeah.
So that's definitely a challenge.
Definitely, I think so too, because like when I talk to like people like the people that I'm currently training, like my family members, close family members that want to lose weight and stuff like that, the biggest thing is like diet and exercise, which is the most important,
Absolutely.
right? Obviously, we know diet is like really up there in you know, importance, and it's honestly more important than exercise when it comes to maintaining health. If you eat healthier, even if you don't necessarily exercise or lift big weights, you'll be pretty good. But that next step is, you know, getting in the gym or doing some type of movement modality to further, you know, increase your health and stuff like that. So
Yeah.
I think that's very important, and a lot of people have to start understanding those things, and that's where like you come in, I come in, and stuff like that, so we can kind of educate. So I think that's the biggest thing. Like a lot of people, I talk to them, it's like, I feel like you should know a little bit about this. Like it's,
Yeah.
you know, like, all right, you should know that that's not healthy, or you should know that that's not conducive to, you know, better posture, or whatever it is that we're talking about. So
Yeah.
I definitely agree with that. Now we'll switch it up a little bit. I want to talk more about a little bit more personal. Like with you, obviously you're a family man and stuff like that, and you got everything going on. You got business stuff going on, and how do you balance all of that stuff?
It's a daily juggling act, honestly. I mean, with 3 little ones at home, and we had our first one, our first daughter, while in school, which was a blessing, but so challenging with like the demands of studying, and my wife was going through her occupational therapy program as well, so just juggling that. But it's tough. Every day is a daily juggling act, but every day is a blessing as well. So I can get caught up in how hard and difficult and challenging and everything is, and all these things that just not doing well or doing right, or I can just like, hey, I did really good on this today. I want to be a little bit better at X, Y, and Z. And just take, you know, I really believe that power of like, you know, 1%, be 1% better each day, and doing that sort of thing with my approach.
Absolutely, always getting better. I say that to a couple of people at the either the gym or like therapy clinic. I say, what are you doing to get yourself better? Like I asked the young lady that we worked with, I was like, so what's going on? What are you doing to get better? And she said, oh, I'm doing this, I'm doing that. I'm like, that's cool. So I kind of keep her on her toes with that. And I feel like it helps you think a little bit, like, because as we get older, you know, become adults and stuff like that, we don't even realize like how the transition is, or how maybe easy we had it when we were, you know, younger and stuff like that. So trying to make sure that we kind of keep up and like understand like, all right, so I'm an adult now, I have, you know, responsibilities and everything, and how do I balance that? So I personally learned from like mentors and people, you know, who are successful to like how to balance and how to kind of put everything into perspective, you know. So I definitely can appreciate that. I even told you, I was like, man, I don't know how you do it, but I definitely appreciate like the fact that you got kids and wife and business stuff, and so I was just like, man, that's really awesome.
You just got to do it. You know, I was just thinking, relating that question to with patients too, just kind of going back on that. You can't fix everyone. You know, every single client you get as a trainer, you can't fix everyone. Every one person that comes to the door with an injury or whatever issue they have, like we can't fix everyone, but we can educate them, like we talked about. We can give them the tools to relieve pain and to move better, and like combining that with getting better every single day and helping them focus on the positive. Especially in the world today, everything is so negative, and you know, just staying positive with that perspective.
Absolutely. All right, let's talk a little bit about certifications. I know that's a big topic. You know, people have their concerns and like, all right, what certification should I get and stuff like that. So,
Yeah.
what do you think as far as certifications, like the top, like primo kind of certifications out there? What do you think?
Yeah, that's a big one. You know, when you're going through school and you're learning, all of a sudden, you know, how do I continue advancing my profession after getting your degree? Do you want to specialize with any of the specialties with the APTA as far as orthopedics or sports or any of those type of specialties, or do you want to go more certifications route? Kind of depends on what your interests are and what you want to not necessarily specialize in right away, but what population you want to work with.
Right.
So one thing that's always interested me that I wanted to do, even before school, just never got around to it, was getting my CSCS. So that's a certified strength and conditioning specialist. Because I always knew I wanted to work with athletes. And having been a former D1 athlete myself, you want to think long term as far as your goals for each athlete, as far as each micro, meso, and then annual cycle. Can't think of those terms right now, but each sub-cycle, as far as breaks down into like 3 months at a time.
Right.
Our goal for these 3 months are just general conditioning or hypertrophy or strength or power, with the goal to peak during your athletic competition performance. So like baseball is like in the spring, so that's when I want to peak. So getting my CSCS, learning how to program over the course of months to a year was really, really big and helpful for me. It's not typically something I use for the traditional clinic and working with general population, but things like strength and conditioning principles and how to load tendons and muscles and tissue like that. That definitely applies, and that's something we don't get enough of during school, that the CSCS helped me understand a little bit better.
Right, and I really like the CSCS because I'm working towards getting that, and I just noticed like the subtle nuances and like the differences that they kind of point out and say, man, I could really apply that to either in the clinic or even at obviously at like a gym setting. So I think that's a really big one. I think that's kind of the top one, the top tier, like kind of general. And like you said, you kind of want to figure out which one you want to specialize in and stuff like that. So that's pretty cool. Tell me a little bit like your approach to like exercise, so like maybe some functional movement patterns and stuff like that. Like what are those big ones that you like to kind of incorporate?
Yeah. So learning this through mentorship, I've applied this to general population and performance-based patients and clients as well. So my goal with every treatment and case is to get, each person to squat, deadlift, and or push press, especially if they are an overhead athlete, volleyball, swim, baseball, tennis. All those athletes should be push pressing overhead, keep the shoulders nice and strong and healthy, right? Everyone definitely should be squatting and deadlifting for back pain and back pain relief, right? Deadlifting is like number one by far. Getting each person to complete low back strengthening exercises and building up a tolerance so they can deadlift and learn that movement pattern. And that's so important because we all do deadlift patterns on a day-to-day basis, such as picking up a laundry basket, picking up your child off the ground. Even golfers, when you pick up your ball out of the hole, that's like a golfer's leg, like a single leg RDL, right? A pitcher following through after he delivers a pitch is like a single leg RDL. So all these activities that, whether it's general population or athlete, we can relate to a functional movement pattern, and that's why it's so important to train these.
Yeah, I think that the deadlift one is a big one because I've even seen some stuff out there and people say, oh, this is why you shouldn't deadlift, and I'm like, wait a minute, this goes against everything that I know and I've learned. So like, kind of explain why that might come up sometimes, like why people feel like, oh, you shouldn't deadlift, it's horrible for you. Why do you think that's the case?
I mean, it could be that person's background and training for whatever reason. Typically when someone says don't do X, Y, or Z, don't lift overhead, don't deadlift, don't squat past 90 degrees parallel, things like that. Typically, not all the time, but typically it's because someone out there has gotten injured doing them incorrectly, and has, you know, what's the word, like, kind of translated it, say, hey, don't do this because I was doing it wrong and I got hurt. So
Right.
they related that to a movement pattern, and
Yeah.
all of a sudden it's based off of fear. So it's then our role and responsibility to kind of re-educate that person, be like, hey, this is why you need to do this, and why it's so important.
With the best form and
With the right
structure,
form,
right?
right? You can't just go from injury to straight up deadlifting,
Right.
you know, a plate, expecting results like instantaneously.
Yeah.
So you definitely have to lay a firm foundation of strength in the right muscles with the right movement patterns, always addressing pain and getting them up to that functional movement pattern.
Definitely. I totally agree, because I think when I was starting out, and I kind of expected that, like, I was like, all right, I'm going to try these deadlifts and put a plate on and I should be fine. And little did I know I wasn't, you know, kind of injuring myself, or, you know, kind of setting myself back. So I'm like, all right, let me take a step back from this, take my approach differently and come back into it. And lo and behold, it worked out, because, you know, if you kind of just jump right into things, usually it's not going to end up well for you. So I kind of like that perspective. And like I said, learning with the CSCS and everything, has kind of been putting everything in perspective with programming and kind of understanding how to, you know, progressive overload and all of that. So I think it's like really beneficial. You know, so.
Yeah, it's hard with that. The term I was thinking of earlier was periodization.
Right.
Right, because especially nowadays with the younger generations, they play sports year round. So it's hard to create a program that periodizes, you know, peaking at this time of year when they play year round.
Right.
Or if you play at like the, you know, collegiate level, you have one competitive season. You know, maybe you have intramurals in the fall for baseball, but then your season is the spring. So that's typically when you want to peak. But younger generations, they're playing year round, so you have to kind of juggle that, keep them healthy, still have to work on strength, cleaning up movement patterns. But yeah, working on that CSS is so important for me, at least with the people that I like to work with.
Yeah, definitely. So that kind of, when you spoke about kids, that kind of brought up a thing that I wanted to talk about. So how do you kind of decipher with, you know, breaking up kids and they like sport specific versus like general strength and stuff like that, and any deficits that comes with those sport specific, you know, athletes that are kids? Like, kind of explain a little bit how that works out.
Yeah. So the term sport specific, I think, is very loosely thrown around by so many, you know, quote unquote professionals out in today's world, especially on social media. Everything is sport specific, when I think the best skills to build up to for every athlete is, again, those functional movement patterns.
Right.
You know, squat, deadlift, push, press, then work on like lunging, carrying, push, pull, those main movement patterns for your foundational of pure strength. Right. And that also leads to developing power and then speed and agility.
Right.
I think the last piece of the puzzle, once an athlete has that solid foundation of strength with those movements, then you can work on kind of combining movement patterns, you know, multi-plane, change of direction, rotation, lateral movements, those things for sport specific. But I think sport specific is a little bit more general than what we tend to see on social media.
Yeah, because I was gonna say, like, obviously every sport has, you know, a component like rotational stuff like that. Like every sport has their own type of thing, but I feel like with children, they need to learn that foundation, those foundational movements, because like right now I'm training a young kid. He's like 11, and I'm getting him just to like understand how to do a squat or a deadlift right. Because if you can't do that, I can't just throw you out there and say, all right, let's go, you know, push press or do anything very, you know, like very compound lift type of stuff. So those gotta understand before we kind of move on to the big things.
Absolutely.
Right? So,
yeah, they have to understand too. That's a good point. You can't just throw someone, no matter what age, but especially younger generations, to the highest level activity just because it looks great on social media.
Right. Yeah.
Especially with young kids, you know, 11 years old. You know, those young ones are still developing and growing into their bodies.
Right.
Like learning how to move, body awareness. Just figuring things out. You know, a lot of those kids, they're like baby giraffes out there. You know, they learn how to walk still and jump. But it's just, if you can teach them how to move correctly, how to take care of their bodies, The stuff later on that's more exciting will definitely come easier, and you're also setting them up for long-term success.
Definitely. I agree, because I even explained to him, like, hey, we're doing this right now because it's important that you understand this, and obviously once we get better at it, we'll move on to some of the more fun stuff, you know. So
Absolutely.
I think that's the biggest thing, just making sure that you guys are on the same page and just kind of understanding where you're at and where you want to go.
Right.
So I definitely think that's a plus.
Yeah. Those big movements too, the squat, deadlift, push, press, they're not easy.
Right.
They're hard, you know, and people, no matter what age, if they're not used to hard work and being disciplined to complete those on a weekly basis, it's you got to continue educating every day. Hey, this is why it's so important. This is why we got to keep doing this.
Absolutely.
So you can get to, you know, the end point and perform better.
Absolutely.
And then once they see and feel the results on the field, then they're much better. They buy in more.
Absolutely.
Focus on the positive. Especially in the world today, everything is so negative, and you know, just staying positive with that perspective.
Absolutely. Well, I think that's all I got for you. What do you think?
I feel like we should do this more often.
I know, right? All right, guys. Thank you for checking us out. My man Cory Ginther here. All right, we're out.
Thank you.